Welcome to the Probate Nation. Our goal each time you visit the Probate Nation is to inform, highlight, and educate you about the issues, challenges, and pitfalls you may face, whether you are probating the estate of a loved one who has passed away or have assumed the ongoing responsibility in a living probate of managing the finances and care of an aging adult as a conservator and guardian. Our show today focuses on an issue that can touch on both the estate probate and the living probate. Adults of all ages, but especially older adults, are encouraged to get their affairs in order in case they should become incapacitated, and to provide for the disposition of their assets according to their wishes when they die. Advanced medical directives, burial instructions, durable financial powers of attorney, a will, revocable trust, beneficiary designations on life insurance and retirement accounts, transfer on death designations, and on are all tools to address these issues. But the capacity of mom to execute any of these documents can be called into question before or after the documents are executed. This question may and often does arise out of a claim that mom has dementia. Neuropsychologists are often charged with answering this question, and we thought it would be very helpful to hear from them directly about what is dementia, how is it diagnosed, and if mom has dementia, what does that mean in very practical terms. Our first guest is co-owner of Neuropsychology Associates of Fairfax, where she is a clinical neuropsychologist and the director of training. She has worked in the field of dementia for almost 20 years and is currently a member of the Memory Disorders Program at Georgetown and Inova Fairfax Hospital. She is also on the board of directors for the Insight Memory Care Center in Fairfax, Virginia. Prior to moving into private practice 11 years ago, she worked as a neuropsychologist for the Veterans Affairs Medical Center in Washington, D.C. Our second guest also is a co-owner of Neuropsychology Associates of Fairfax, where he is a clinical neuropsychologist and director of research. He received an undergraduate degree from Cornell University and his master's and doctoral degrees in clinical psychology from the University of Maryland at College Park. He completed his postdoctoral fellowship in clinical neuropsychology at Georgetown University and the Veterans Affairs Medical Center in Washington, D.C. He is assistant professor of neurology at Georgetown University Medical Center and is the executive director of Washington Neuropsychology Research Group. In addition to his private practice, he has been qualified as an expert witness in numerous legal proceedings involving the impact of dementia on a person's ability to make reasonable financial and health decisions. Please welcome Drs. Cynthia Sullivan and Jeff Wilkins. Welcome.
Thank you.
Thank you.
Thank you so much for coming by and visiting with us today. Cynthia, what does a neuropsychologist do?
Well, a neuropsychologist is a person who's obtained a doctoral degree in clinical psychology, has gotten licensed to practice as a clinician, and has spent at least 2 years in a postdoctoral fellowship in neuropsychology. And neuropsychology specializes in assessing cognitive disorders, thinking abilities in people. We are not therapists, we don't do counseling, but we're more allied with the medical profession. So we do diagnostics. We help them determine diagnostics, whether a person has dementia or not, and then we're also interested in studying the behavior of that person.
Okay. Now, Jeff, is there an order by which one who's being treated as a patient actually begins to evaluate and figure out whether they need to go see a neuropsychologist?
Sure, yeah. Usually people don't make it to us first. Typically, family or the person is becoming concerned about their thinking, their decision making, and then they get to their primary care physician. Sometimes the primary care physician will send them right to us after that, but often they'll go to a neurologist first. The neurologist is going to do a whole series of other tests, and included in the series of tests will be the neuropsychological evaluation. So that's typically when a person gets to us and undergoes our evaluation.
So before they get to you, that testing, does that establish dementia before they get to you?
Not really. A lot of the tests that neurologists or primary care physicians will send patients for are tests to rule out other things. They'll send them to get brain imaging to rule out things like stroke or mass, some kind of a neoplasm like a cancer. They'll send them to get EEGs to make sure they're not having seizures. Whole variety of other tests that can rule out other conditions. None of those tests can rule in the dementia. It's really when they get to us that's what they're asking about.
Okay. Now, Cynthia, let's talk about Can you explain in layman's terms just what is dementia?
Yes, so dementia is a progressive neurologic condition that affects someone's thinking abilities and also their behavior. The formal definition involves memory impairment plus some other areas of cognitive decline, like trouble making decisions, trouble reasoning, trouble focusing or processing information, trouble coming up with words, talking, understanding other people. And also there has to have been a decline in their functioning in daily life.
So that really leads me to my next question. Does the dementia occur overnight?
No. It might seem to, in some people, occur overnight, but in those cases, most likely it's been occurring gradually over time, and they've attributed it to other things, like I haven't been sleeping well, or I've been feeling down, or I've been very stressed lately. But in most people, dementia will develop very gradually, insidiously over time.
Okay, so then, Jeff, what I gather from what Cynthia is telling us is that dementia, once it's diagnosed, is progressive, or is it static?
It's definitely progressive, yes.
Okay. Now, are there stages of dementia?
Yes, usually, as Cynthia was saying, very early on, it's not even really attributed to the brain changes. But as time goes on, we get into what we would call a mild dementia. And that's when a person is having the problems that you just heard described. Memory is significantly impaired. Even in mild dementia, memory is significantly impaired. We see some reasoning problems, some judgment problems, but the person is still with us. When you talk to them, they know who they are, who you are, but they're having problems. That's a mild dementia. Get into more moderate dementia, we have a person who's fairly incapacitated in terms of their ability to reason and think. Their memory is definitely not good, shot at that point. They may have some trouble recognizing people, trouble kind of even carrying on a regular conversation. That's more of a moderate dementia. And then we get into a more severe dementia, which is what you think of when you think of almost a vegetative state, where a person is just not there. You can't really talk to them. They don't know who you are. By that point, there's no question. They're not making any decisions at all for themselves. And
okay.
Pretty severe.
So we have this progression of dementia. We go through these phases of mild, moderate, and severe. These things don't necessarily occur in a particular time frame. They occur when they occur. Each person is different. But Cynthia, is there a medical advantage, though, to early diagnosis of dementia?
Absolutely. In fact, the medications tend to work better the sooner you catch it. So the earlier the better in terms of diagnosis. We know that it is progressive. Obviously, it's going to get worse, and the medications that we have that are available now will actually not cure the person. They don't bring you back to the way you were before, but what we know they can do for most people is kind of halt the progression for a while, so they can keep you at the level that you are when you started the medication. So obviously, the earlier you start, the longer you have at that milder form. If you wait to start later, then you've lost that opportunity to stay at that higher level of functioning for a longer period of time.
Well, that's important for our listeners to know as we begin to identify and talk more about signs of things to be concerned about.
Absolutely.
Well, let's take a look. We folks have made it to your office through this progression of medical treatment. We're now, they've come to you for a neuropsychological evaluation. And Jeff, what is the most comprehensive and complete way to test for dementia?
Yes, that's before they get to us. People will often have gone through what we call a mental status exam with their neurologist or with their primary care doctor. Some people have heard of the mini mental state exam.
Very much so.
It's a simple tool, but doctors, the physicians usually know that if a person does badly on it, we have a problem. But if a person does well, it's not very sensitive. It doesn't pick up a lot of things. So if a person does well, we don't necessarily know that they're actually doing okay in their lives. So then they get sent to us. We do this thorough evaluation where the neuropsychological evaluation, which is looking at memory, attention, reasoning, language, all the different areas of thinking that we need to think about with dementia. And this evaluation is really the rule in. As I talked about before, all those others are rule outs. This is where we look at the across the board cognitive functioning how it affects people and then affects their functioning.
Okay. So, Cynthia, are there specific tests? I know Jeff has talked about different, but are there specific tests that are done in the course of this particular neuropsychological evaluation?
Yes, there are. We use standardized, validated measures that assess someone's ability to focus, process, learn, remember, reason, problem solve. We're going to cover all those areas, including language, their ability to come up with words, express themselves coherently, but also understand what other people are saying to them.
Okay, okay. And so that's very comprehensive. So Jeff, is it, in connection with doing that neuropsychological and all that testing, is it helpful to review medical records for the person being tested in advance?
Yes, absolutely. Because when neurologists or primary care docs send their patients to us, they're thinking that it might be a possibility that there's dementia, but they don't know. What they're relying on us to do is not only take a look at our own results, but take a look at them kind of within the context of everything else that's going on. What's going on in the medical records in terms of how they've presented to their doctors, what's going on in their real lives, because often records will include notes from family members raising concerns, calls into the doctor's office saying they're forgetting their medicines. They want us to know that this is going on, they want us to review it, and they want us to look at the other tests and see if we have any opinions often on whether something else could be causing this. Because once we make this diagnosis in our reports, and once we suggest the diagnosis, it's pretty serious. They want us to be sure that we've taken everything into account.
Sure, okay. Cynthia, we're in for testing. How long does the testing normally take?
Well, the testing is always going to involve some time with the doctor going through a history. So we're going to interview the patient, we're going to interview family members if they're available, and like Jeff was saying, we want to know what's the history here, how long has this been going on, what's been the impact on their daily functioning. And so that takes a good hour of the time just talking with the family, and then another couple of hours for the actual measures to be administered.
Okay, okay. So Jeff, while it's not specific to this show, I'm being a lawyer, I'm just curious, does insurance pay for this?
Well, it does.
Or does Medicare pay for this?
Medicare, yes. So the way it works is, if we got a referral from a lawyer, that's a little bit more dicey in terms of insurance. It has to come from a medical professional.
Okay.
So yes, it pays for it if the doctor referred. So Medicare requires medical necessity and us to be able to show that if we get a referral, and that means a referral from a doctor.
Okay.
So as long as we have that referral, it covers it, and actually a lot of private insurances cover it too. It's just a matter of making sure it's gone through the right channels.
Okay, excellent. Well, let's talk about signs of dementia, because we talked about how we're going to test for it, but I think what are the balloons that are going up that send off a signal we ought to be taking a look at this? And so, Cynthia, what are some of those? Are there signs in the behavior of a person that might actually signal dementia?
Yes, absolutely.
Okay, so what are some of those signs? I mean,
so one of the first things you might notice is the forgetfulness, that the person is not remembering something that you just told them a few minutes before, or they're having to refer to their calendar constantly. You tell them when their next appointment is, and they're asking you again within 5 minutes, not even realizing that they've already asked you that question. So they start to repeat themselves. They start to get confused about things that they had done easily before. That, if grandma used to be able to check her email easily, and now she's having trouble remembering the steps to get onto the computer and do that again, or she's having trouble managing finances, making mistakes in the checkbook, forgetting to pay a bill, or maybe paying a bill twice because she doesn't remember that she already paid it. Same thing can happen with medications. You take a pill twice because you don't remember that you've already taken it, or you find that she's forgotten several days worth of medications and has gotten confused about what day it is. And so, serious implications here. Very much so,
very much so. And so people should be very attentive as they see their aging relatives and loved ones to see if those things start to happen.
Absolutely.
So, well, let's talk about the implications of dementia. I know we see that as lawyers a lot. Does a dementia diagnosis, Jeff, mean that the person lacks capacity?
That's a very complicated, and it's a good question. It may mean that. It's not necessarily going to mean that, but this is why we have to start looking into it. I mean, there's a lot that goes into the answer to that question.
Okay, so let's just assume that if someone has dementia, what does it mean in practical terms as far as things they can and cannot do?
So this is even, so if we get into even mild dementia, you asked if capacity is affected. Here's where you might have a person whose memory is impaired, but and maybe they're not expressing themselves well, not understanding certain instructions, but maybe their reasoning is intact. And that's a person that may be able to understand things okay. And capacity may be okay, although I would still want that person to get some, at least some guidance. But as we get into more of a more mild to moderate dementia, well, the things that get affected are going to be being able to reason and make judgments about different things that they're supposed to sign, documents, contracts, finances. They can start to have problems driving. They can start to maybe it's not the best idea anymore because they're getting confused, and that can lead to accidents. They may not be able to do some of the hobbies they used to do. Sometimes firearms, owning firearms is something we really seriously need to wonder about with somebody who's getting along in dementia. So a whole variety of different things get affected. And then we also have to talk about their ability to manage their health. What if somebody has diabetes? You heard from Cynthia about taking medications twice. What if you're giving yourself too much insulin?
Oh, goodness gracious.
Potentially very dangerous. And so there's where we start to reason with our family. You try to reason with the people about needing some help, but whether or not they like it, we really have to start trying to help in those situations.
Of course, that makes lots of sense.
Yeah.
Well, let's talk a little bit. So these are important things to keep in mind, the very practical implications if someone is starting to show these signs. We need to be careful and cautious. Let's talk about treatment options. Cynthia, I know you mentioned that there is some medications out there, but let's just talk, what do people do, once they've been diagnosed with some level of dementia, let's just say mild, we're in the beginning of that process. What are the treatment options that you guys see normally?
Sure. So there are some medications, like I mentioned before, that can help at least kind of slow the progression. As Jeff had noted, it is a progressive condition, so we want to kind of halt that for as long as we can. But in addition to that, some things need to take place in terms of their environment. So even with mild dementia, as he was saying, you're going to have potentially some problems managing activities of daily living.
Sure.
So family members need to get involved, or friends, to make sure that there's some supervision, especially with potentially dangerous activities like cooking, making sure that the stove is turned off, the oven is turned off, taking medications, not falling victim to scams, which are out there, and elderly people can be very vulnerable, obviously, especially as memory is declining and judgment and reasoning are slipping. So we have to have those environmental changes taking place so that there's safety for that person who has the dementia.
Of course, of course. Wow, there's a lot of stuff. It's almost scary. I'm starting to think that I might have dementia. For our viewers, I want to make sure it's clear I do not have dementia as far as I know. But let's go to some closing comments. I know you guys cover a lot of material here, and you see a lot of folks on a regular basis in all spectrums of the dementia, the quadrants. Some final comments and suggestions you have for folks.
One thing I'd like to say is that it is important to know that as we age, everyone experiences some degree of forgetfulness. It is a normal part of aging to feel forgetful, to not remember things as well as you used to feel a little slower, sometimes you can't come up with the word you're looking for. That can all be part of the normal aging process. And I think what neuropsychologists can do that's so important is to differentiate between what is normal and what is not normal, because once we know it's not normal for your age, then we can get the treatment on board right away. And I think it can be very reassuring for people who are just experiencing the normal changes related to age, and maybe they are not getting enough sleep and they're feeling a little down. So we can address those issues and the person's going to be fine cognitively, versus finding out that it really is something not normal for age and it's not related to these other things that are going on in their lives, that it really is a brain condition, and then we have to go a different route with treatment, and that's where neuropsychology can be very helpful.
So it's that whole process of beginning to rule out what it is not.
Exactly.
So we can figure out what it is.
That's right.
That's the interesting part about medicine.
Yes.
So, Jeff, how about yourself? Have some final thoughts and comments you want to share with our viewers?
Yes, just kind of going on the next stage of what Cynthia was talking about. Once you find out there's something wrong, it's really important to then help the person. We need to, even before this, I mean, I've been told by my own state planning lawyer, you got to get a power of attorney in place. This is something you should have anyway. But if it's not in place, get it in place then, once you figure out there's something wrong for sure. And then get some other things in place. Make sure your family members, professionals helping these people, including attorneys that are working with them, making sure that this person, knowing that this person doesn't always realize that they don't have the supports in place that they need, whether it be for health or finances. And once we have that dementia diagnosis, that needs to be there. And it may need mean involving family, it may need involve third parties, financial planners, whatever is necessary to protect the person, make sure that they're living a healthy rest of their lives, both financially and physically.
Well, it sounds like, once you get to that dementia diagnosis, it is a call to action.
Absolutely.
On different levels that you can't really sit and just twiddle your thumbs. You've got to take some steps.
And we have a lot of families who come in who, it's a horrible diagnosis, and they could be a little bit in denial. And so they might not want to do anything, let it just ride a little bit, not upset the apple cart, so to speak. But you really need to, especially earlier on, because that's when you can reason best with the person to try to get things in place that are most in line with what they want.
Absolutely. Yeah.
And I think it's really interesting. People sometimes think that someone is getting better because they have a good day.
Right.
And what I take away from your comments and talk today is that that's really not what's happening.
No,
Right.
people have good days when they have illnesses, and they just might be seeing a good day. And unfortunately, when it's dementia, doesn't usually get better.
It's sad,
It is
but
sad.
it's something that we have to deal with. And well, look, I want to thank you both, Cynthia and Jeff, for taking the time and coming and speaking with us. It's been fantastic information, very helpful to our viewers, and it's really a great public service that you've extended to the Northern Virginia community.
Thank you.
So thank you
It's
very
been our
much.
pleasure.
Thank you for having us.
Thank you for joining us. The possibility of dementia is something that many of us have to consider as loved ones age. You begin to notice little things like mom not remembering the names of children or grandchildren, or getting lost while driving to a doctor's appointment. Or you might see stacks of unpaid bills at mom's house, or foreclosure notices start arriving because the mortgage has not been paid. What this means medically depends, as everyone is different, but it probably merits a discussion with her medical providers. What it means in practical terms can be significant, as it may be an indication that mom may now need assistance or possibly lacks the ability to handle her medical and legal affairs. It could also mean mom may lack the capacity to execute legal documents. There is no black and white answer here, so we encourage you to be attentive as your loved one ages and seek the necessary medical and legal advice from that loved one if you have concerns. This brings us to the conclusion of our show. We hope you found it helpful. Replays of the show and all the shows broadcast to date, along with other helpful information, can be viewed on the Probate Nation website. On behalf of the Probate Nation, thank you for visiting with us.